Hi, I'm Dr. Neneman with Neneman Chiropractic Clinic, and thanks for joining us again in another week in our video blog series. The last few weeks I've talked about pillows. I'm going to kind of continue on along the same line, and this week we're going to talk about sleeping positions. This is something I get asked a lot about by patients, so I'm going to go over it today. What I always tell patients is the best sleeping position is to be flat on your back. I mean, there's nothing beats it. It obviously, by laying straight on your back, you're keeping your spine aligned. Usually as long as you have a good pillow, you're going to keep your neck properly supported. The back's properly positioned. One thing with back sleeping that can help you, if your legs are out flat on the bed, sometimes it can put your lower back into a little bit increased arch. It can put a little bit of pressure on it. So one way to combat that is to actually bend your knees, slide your legs up so that your knees are bent. It helps kind of flatten your lower back a little bit to where there's not so much increased curvature in there. It'll take a little bit of stress off your lower back. So that's one way to combat that. But I mean, sleeping on your back is the best position. Now, one thing I always tell patients is that when you're unconscious sleeping, you can't always control the position you're in. When you're unconscious and you're moving around, you don't know what's going on. You really can't help that. But what's key is when you do wake up, you usually wake up here, here and there throughout the night. You're conscious for like, a few seconds. But if you notice you're in a bad position, get out of it. That being said, most people do end up on their side, myself included. I always usually start on my back, but I always usually roll to a side because it's generally a little more comfortable. And I do it again unconsciously without even knowing I'm doing it. But the biggest thing, it is okay to go to side sleeping, but the biggest thing I tell people is to put a pillow in between their legs. And that's because when you roll to your side, generally it puts a lot of torque on your pelvis and your legs. Your knees will be laying together, and it puts an abnormal torque on your pelvis and your hip joints. By putting the pillow in between your knees, it actually keeps your legs parallel as you lay on your side, and it helps keep your pelvis and lower back aligned. So that's one thing, if you are going to sleep on your side, put a pillow between your legs. One other risk with sleeping on your side, and this is another common complaint, but typically it can really irritate or bother the shoulders, because when you're laying down on your side, it tends to compress the shoulders, and I'll have people tell me they wake up in the middle of the night or they wake up in the morning, their shoulder hurts. So that's, again, another benefit to back sleeping is it keeps your shoulders nicely pressed against the bed evenly so that there's no compression. The last position I'll talk about, which is an absolute no-no, and a lot of people like it, unfortunately, but it is stomach sleeping, laying on your stomach. It's bad. Number one, when you lay on your stomach, you're not going to sleep with your face straight down on the pillow. You can't breathe. So you're either going to put your head to the left or your head to the right. And when that happens, it's putting a ton of torque on your neck. I mean, your neck is cranked to the side, and if you sleep like that for hours at a time, I mean, you really can mess up your neck. Create a lot of stiffness, soreness, but it can also start affecting the curvature of your neck in the long run. So it's got obvious adverse effects to your neck, but with your thoracic and lumbar spine too, just laying on your stomach with gravity pushing down, it tends to put your spine into hyperextension a little bit. And it really irritates the facet joints. I mean, I've had people all the time come in and say, I slept on my stomach, my lower back's really sore this morning. Again, it puts increased pressure into your spinal facet joints, can put you into a little bit of hyperextension. So stomach sleeping is an absolute no-no. Some people say that's the only way I can sleep, it's comfortable for me. That's great, but it's going to mess up your back and your neck. So if you're a stomach sleeper, you need to either start side sleeping or back sleeping. Again, if you're side sleeping, use a pillow between your legs, and hopefully it won't irritate your shoulders too much. So, hopefully these were good tips for you on sleeping and sleeping positions. Try these better positions. You may notice that your spine starts feeling a lot better. So, have a great rest of the week again. We'll have a new topic for you next week. Enjoy the weekend. We're going to have some nice weather, supposed to get up in the 70s. So we'll see you next week. Thank you.